I see a lot of women in my practice for recurrent urinary tract infections, and these are expensive, time-consuming, painful, annoying, and really I see women of all ages that are plagued with this problem. And so I think the first step with this problem is making sure that you're really having recurrent urinary tract infections. Many women get antibiotics because they have symptoms of a urinary tract infection, which may to them be a smelly urine or dark urine or a little bit of discomfort. And it's not really, they come to me, I'm not really sure if they had a true urinary tract infection, and by that time they may have gotten many rounds of antibiotics and their symptoms have not improved. So it's really important, one, to make sure that you are having culture-proven infections or that your doctor is sending urine cultures for these problems. And then the way to prevent these infections is, one, drinking lots and lots of water. So the more you drink, or lots and lots of fluids. If you don't like water, you can use other fluids, but drinking lots and lots of fluids can help clear out or dilute the bacteria that's in your urine and help you flush the urine out. So 40% of women can actually prevent infections just by drinking a lot of water, and actually they're self-limited and they'll go away on their own. Another thing that I tell patients to do is using cranberry tablets. So there's a big myth that cranberry juice can help prevent urinary tract infections, and the juice itself is just loaded with sugar and doesn't have the right concentration needed to actually prevent infections. Cranberry tablets, or very concentrated cranberry juice, which does not taste very good, you can use it should have 36 milligrams of proanthocyanidins, and that's the effective dose that's been studied to help prevent recurrent urinary tract infections. Another reason that people have infections is because they're not emptying their bladder well. And a lot of women come to my office and they're holding 3 or 4 or 5 ounces of urine in their bladder even after they urinate. So some of that is making sure you're fully relaxed when you're going to the bathroom, that you're sitting down comfortably, and you're emptying your bladder to completion. And then sometimes that requires that you do it twice. So I tell people, sit down, go to the bathroom, stand up, walk around, and go, and then sit again and go to the bathroom again to make sure you're completely emptying. Because if that urine sits in there, it's basically food for bacteria to form. And then I tell women, they get very concerned, I'm very clean, I do, and I think the patients with recurrent infections are the cleanest people I see in my office. There is, you're not doing anything wrong. This is a problem that we don't completely understand, but it's probably due to factors of the way your bladder functions or the way bacteria has leached onto your bladder wall. It has nothing to do with how clean you are. So I think that, patients should feel reassured that you're not doing anything wrong. This is a problem that needs attention and that needs care. Sometimes because they're cleaning so aggressively, they're actually creating more problems. So they're creating discomfort because they're washing so aggressively. So I tell people, just let soapy water run over the urethra and the vagina. It's a self-cleaning oven. You don't need to do more than that. So yeah, I think those are the first things that you can start easily at home. And then, if you're still having infections despite that, definitely come see a urologist or your primary care doctor to see what other options there are to help prevent recurrent urinary tract infections.